We are at a pivotal moment in digital health. The pace of change is unprecedented. We need to go together as we embrace both strategic and tactical options to deliver healthcare in more coordinated and accessible ways.
The Digital Health Festival was a great opportunity to connect with healthcare providers and suppliers across the industry. It's clearly a time of unprecedented change and transformation. I heard about the use of edge computing and the Internet of Things to help uplift and extend in-home aged care and reduce the burden on residential aged care facilities.
There are lots of risks if new technologies are introduced without a governance-first approach. Senior advisor at the TGA, Dr. David High, made some interesting observations. Firstly, he said that many developers are including AI in their medical devices and their startups, brand new to the TGA regulatory landscape. Dr. High also noted that the Therapeutic Goods Administration is seeing applications for approvals for AI systems that have been trained on really small data sets. One of his examples used as few as 9 positive results in a diagnostic report. That's very small. He also said that they're seeing tools that are being trained on data that doesn't match the use population. This creates risks that the tool will be biased, inaccurate, or unreliable. Although the TGA is appropriately knocking back those applications, that is, they must prioritise transparency, accountability, and security before adopting a new technology. In practice, this means board and executive members need to put policies and principles in place to ensure that the key risks are appropriately managed before taking on new AI and emerging health tech.
Here's some food for thought. $17 billion. That's the estimated costs to the Australian economy arising from mental ill health in the workplace through absenteeism and presenteeism. With the expected number of psychological injuries claims expected to blow out to 1 billion by 2030, how will employers respond and ensure they are meeting their regulatory obligations?
So I talked on a panel about the patterns and promises of psychologically safe workplaces. The first key takeaway was about the importance of good data to inform our risk assessments and to identify control measures that we can adopt to eliminate or reduce psychosocial hazards in the workplace. The second key takeaway was the importance of involving senior leaders and the role that they play in setting the tone and culture of an organisation.
But it's also clearly a time of unprecedented innovation. From generative AI and its enormous potential to create efficiencies by automating things like clinical note-taking, whilst also potentially improving patient outcomes by working side by side with care providers as an additional diagnostic tool.
The one certainty in all of this is that AI technology will continue developing faster than regulation can keep up. For lawyers with TGA expertise, that just means the curling medical device questions will continue to challenge us.
So there clearly are challenges, but also immense potential and excitement to rise up to them using innovation and transformation, and by working with trusted partners who can help them take them on that journey.
To discuss your organisation's digital health transformation or these insights, contact us or go to minterellison.com.